in the urine. Okay, what about positive nitrates? Because nitrates are produced by bacteria. Yeah, nitrites. Oh, Leslie, congrats. Patty also just give me news. She also passed. So good on you guys. Really appreciate. Really appreciate. I'm so great that I have been a bit helpful for you guys. So that's lovely. Nice. Okay. So nitrites are produced by bacteria because bacteria converts nitrates into nitrites. So definitely this will be positive. Okay, it strongly suggests UTI. And what about specific gravity? What about specific gravity? Is that normal? Is specific gravity direct indication of UTI? Normal. Yeah, because specific gravity is not gonna be direct indication. Okay, specific gravity is not direct indication of UTI, so this is incorrect. What about WBC? What about WBC, guys? 10 to 15 HPF. Yes, because normal range is 0.0 to 5, so this is quite elevated. It indicate infection. Thank you, Nancy. What about protein 3 plus? Is a protein indication of urine infection? Is protein indication of UTI? No, this indicate if there is some other kidney disease going on. Okay, especially like nephrotic syndrome. So that's why this is wrong. What about few epithelial cell? Hello, Margaret. If we are having few epithelial cell in urine, is that infection? Or can it come by other way? Remember, guys, it's few, okay? Remember, that's the thing, that's the keyword. Few is normal, okay? Few is normal, few is not nothing wrong. Alrighty, so because it can come from skin also, so keyword here is few. Anything few, anything mild is normal, okay? It's not concerning. Alrighty, question number 21. We are aiming for 30 question today, so let's ace it. A patient on spironolactone for heart failure also has CKD, which concurrent order prompt clarification. Select all that applies. So we know spironolactone is potassium sparing diuretic, but here thing is patient also having CKD, so that's why we have two things going on there. So we need to choose which medication. Potassium supplement, and we already talk about spironolactone. It is potassium sparing. We do have already higher chances of hyperkalemia. So is A gonna be correct? Yeah, A, yes, yeah, because if patient is on potassium supplement, there is higher chances of hyperkalemia. Okay, so we don't want that. Let's move to B, ACE inhibitor. What is ACE inhibitor? So when we have angiotensin converting enzyme inhibitor, they cause the potassium retention. Yes, they cause the potassium retention. So if we are having ACE inhibitor and we are having spironolactone, they both gonna retain potassium. So that's gonna cause increase the chances of hyperkalemia, so we don't want that too. So we will question this one. What about low sodium diet? So if somebody is having CKD and spironolactone, do we need to worry about low sodium diet, or is it recommended? What happened during CKD? See, no, yes, because okay, this is appropriate recommendation, especially during the heart failure, to reduce the fluid overload, and in CKD also, okay, because kidney doesn't have enough power to excrete fluid. What about salt substitute? What about salt substitutes, guys? Are we gonna question that one? Do we need clarification on D? What can happen if there is some salt substitute? Yes, okay, some of them can have potassium. Okay, they usually made with potassium chloride. So we're gonna question that because spirolactone is potassium sparing. That's gonna increase potassium in body, and if we are giving potassium also, that's gonna increase chances of arrhythmias. What about daily weights? What about daily weight? Are we gonna question? No. Okay, we don't need to question E. Okay, because this is recommended action. We don't need clarification on that one. And what about F? NSAIDs as PRN. It doesn't matter whether it is as a PRN. We can still question it because NSAIDs cause. Is NSAIDs recommended in kidney disease? No. Yeah. Okay, so we're gonna need some clarification on this one also, because it can cause kidney damage. All good, guys. Let's move to question number 23. The nurse provide teaching for a patient with peritoneal dialysis about preventing peritonitis. Which point are essential? Select all that apply. So we know peritonitis is most common complication and serious complication of peritoneal dialysis. So we need always aseptic techniques. Yes, we always need aseptic techniques. Guys, please keep double tapping. Please do share and make this at least 10k. Please double tap till 10k. Okay, so we are having peritoneal dialysis now, and then we need teaching about preventing peritonitis. That is the important. What teaching we can recommend? BCEF. Thank you, Roma. BCEF. Okay, let's go to A first. Mask during disconnection. What will happen if wearing a mask? Can wearing a mask reduce the contamination, especially during the connection and disconnection? No. What if there is a chances of droplet dropping on the connection? If there are some droplet going on the connection, can it increase the infection or chances of infection? Yes. Okay, so that's why we will say it yes. Okay, just to prevent the infection from droplets. Alrighty. What about B, hand hygiene before handling equipment? Yes, yes, Nado. Yes. Okay. Hand hygiene is most important step in preventing infection, guys. What about C? Keep catheter exit site dry and clean. So Tahara, in option A, because sometime we are sick and if we are changing the tube or catheter or connection, our droplet can drop on that one and that can cause infection. Okay, so that's why mask is preferable if we can put it on during connection and disconnection. Okay, just to prevent the droplet contamination. Okay, C, keep catheter site exit site dry and clean. Correct? Because if we are providing proper care about exit site, then it's gonna um, prevent the bacteria from entering the peritoneal cavity. So this is good. What about D, forcefully flush connection to clear bacteria? Can we flush the bacteria? No. If we will flush the bacteria, it's going inside. So that means it's going into peritoneum cavity and that means it's gonna cause peritonitis. Okay? It should never be done. Thank you for subscribing, Narsingi. Really appreciate. Okay, so D is incorrect. What about E? Report cloudy effluent promptly. We done that before. So this is the first and most important sign of peritonitis. Okay, so we need to send that bag for the lab just to make sure like which kind of infection is going on. And what about F, guys? Use aseptic technique consistently. Is it the overarching care? Yes. Okay, this is one of the principle to do PD care. Alrighty. So nice one, nice one. Keep double tapping, guys. Really appreciate. Thank you. So 24. A patient with AKI in the diuretic phase is at risk for which complication? Select all that apply. So we having acute kidney injury. Okay. But the patient is having diuretic phase. Okay. And we need to work on complication. What complication can happen? Okay. What about hypovolemia? Nice, Dorian. Good one. Hypovolemia is diuretic. It's not oligouretic phase. In diuretic, kidney can release too much fluid. Yes. And that can lead to hypovolemia. Yes. Okay. So A is yes. What about B? Hyponatremia. Where sodium goes, fluid goes, and kidney also do that. So they excrete in the same way. So if there is hypovolemia, sodium is also excreting with water. Okay, yeah. What about hyperkalemia? Are we gonna see hyperkalemia or hypokalemia? No, yeah, because during the diuretic phase, kidney will excrete potassium also. Okay, so that's why you will not see hyperkalemia, you will see hypokalemia because large amount of potassium is getting excreted. Okay, make sure which phase is going on. Thank you, Kirat. Yeah. What about hypotension, guys? What about hypotension? Is hypotension the reason? Yes, because now we have hypovolemia, loss of fluid. We have loss of sodium, okay, and that's why now we have hypotension. So just we are following the leads. Pulmonary edema, what's we gonna have? Are we gonna have pulmonary edema or are we gonna have dehydration? No, because pulmonary edema happen during oligouric phase, not diuretic phase, okay. Yeah, so if we are having oligouric phase of AKI, then you will have pulmonary edema because kidney is not excreting too much fluid. Nice. Okay, let's move to question number 25. Make sure guys you are double tapping. We are gonna do 30 questions today. And make sure you subscribe Nursingy also at AKI, acute kidney injury. Acute kidney injury, it can be immunological, it can happen due to lot of stuff, okay. Yeah, and it does have different phase. Yeah, like NSAIDs, antibiotics, metformin, lithium, anything toxic that can stay in body will cause AKI. Okay. What about this one? The nurse care for a patient with autosomal dominant polycystic kidney disease, ADPKD, okay? And which instructions are appropriate? So this one is inherited genetic disorder because it's autosomal, okay? This is genetic disorder and usually have like sacs, kind of cyst into the kidney, alrighty, so they can get bigger. Monitor, control blood pressure. Okay, now we know because it's gonna decline the kidney functions and kidney failure, this can cause the kidney failure, so we need to know like, okay, what kidney's functions are. Monitor and control blood pressure, is it appropriate? Yes, okay, because hypertension can be severe complication of ADPKD. And what about avoid contact sport? B. Now our kidney is enlarged, okay, in this condition. So if kidney is enlarged, there is an increased risk of there is increased risk of trauma, okay, and that can actually cause the cyst to rupture. We don't want cyst to rupture, so B is correct. Yeah. What about C? Maintain hydration. What will happen if we are not maintaining the hydration? Yes, 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 it is yes. So we will have too much stone, okay. There is a higher chances of stone formation, yeah, cause kidney is not working properly, that's why there is higher chances of stone formation. What about high dose NSAIDs for flank pain? We know NSAIDs are not recommended in kidney injury, yeah, okay, cause it's gonna cause another damage, further damage. Keep double tapping guys, really appreciate. Genetic counseling for family, we need 10k double tap, 2.7k now, we need 10k. Do we need to do genetic counseling? E, yes, yes to E, because this one is genetic problem, genetic condition, so we need counseling, that is the important part of care. And report gross hematuria. What about F? Just to F, just to F, yeah, because if we are having gross, that means the cyst is rupture, okay. So if we are having gross, cyst is ruptured, so we need to actually report that one, okay. Let's move to question number 26. If we will finish bit early, then we will do some maths calculation today, okay, after 30 question. What is ADPKD? So this is the autosomal dominant, polycystic kidney disease. So when we say polycystic kidney disease is have genetic reason, but there are too many cysts in the kidneys, okay, and then cyst can grow and they can diminish the kidney function, they can burst out. That's why you will have blood in urine. Kidney will be enlarged because it can't work properly, and to work properly it need to adapt according to conditions, so there will be enlarged kidney, okay. Okay, question number 26. The nurse is preparing to administer IV contrast for a CT to CKD patient. Alright, so we have a patient with CKD and we are gonna prepare that patient for CT scan. Okay, which actions are appropriate? Select all that apply. And what we learned about IV contrast last week? What we learned about IV contrast? Can we give IV contrast to patient with kidney disease? Yes, no. Kidney damage? No, yeah. Okay, so that's why it's very important, because IV contrast dye is mostly nephrotoxic and it can increase kidney injuries. So we need to be aware about lot of things before. Okay, verify baseline creatinine eGFR. So we need to know that, because that means we are just checking how much nephropathy is gonna happen there, and it will check the risk. Okay, confirm no allergy to contrast, iodine, shellfish, no shellfish. So if somebody is allergic to iodine, contrast, and shellfish, then that means we are not gonna do that. So we need to confirm that. Okay. What about C, guys? Consider alternative imaging if EGFR severely reduced. What about C? Can we go for ultrasound? Yes. Okay, we can go for ultrasound if this is the issue. Ensure aggressive diuresis post scan with furosemide for all. What will happen if we are doing aggressive diuresis? D, no. Yeah, D is no, but why we need to? D is definitely no. Dehydration, because now it's gonna make, when you will give too much furosemide for aggressive diuresis, then it's gonna cause too much damage. Kidney CKD can't work properly, okay, not on optimum level of function, and then we want it to work so much, it's gonna increase the damage, guys. Hold metformin per facility provider protocol. Is E always correct? Yes to E? Yeah. Okay, E is yes. Especially when it's saying per facility, because what can happen, metformin usually accumulated in kidney and can cause the damage to kidney also, and but lactic acidosis, and that can lead to more severe kidney damage. Okay, provide hydration as ordered. Yeah, F is yes. Yes, definitely F is yes, because yeah, F is correct to flush that dye. Yeah. Okay, we are gonna do provide the hydration, but we are not gonna provide aggressive diuresis. Nice. Well done, guys. Let's move to question number 27. So the nurse evaluate dietary teaching for a CKD patient with hyperkalemia. So we already have hyperkalemia in patient. Which food should patient limit? So now we need to find out. We don't want to give too much dietary potassium. So is banana have potassium? Does banana have potassium? AEF? Actually, I think so most of them have. So banana does have potassium. Orange juice usually high in potassium. Yes. Okay. So orange does have potassium. Okay, guys. It's not only vitamin C. Orange also have potassium. Okay. So from these options, I think it's more about remembering which option. Except apple, everything have potassium. Okay. Yeah. Except apple, everything have potassium. So we can be quick on this one. Please guys keep double tapping, really appreciate. Yeah. Okay, so accept apple, everything. So apple is recommended as safe fruit. Yeah, green leafy vegetable, mostly all the electrolytes. Yes. Nice. Okay, let's move to uh question number 28. Yes, Dazane, definitely potatoes also have high potassium. But if you are doing double boiling, there is a method about double boiling potatoes that will reduce the potassium content. Okay, so if somebody really need potatoes, there is a method double boiling. Boil it twice. Okay, but usually not recommended because you don't know how much it lost, so we really don't want to recommend potatoes also. Okay, 28 guys, the nurse review order for a patient post tub with continuous bladder irrigation. CBI, which action are correct? Select all that apply. So we know TERP is prostate surgery. Yeah, we discussed that yesterday in our first 20 questions. Why we need continuous bladder irrigation? Why we need continuous bladder irrigation post TERP? So post TERP is like transurethral resection of prostate. Okay, so it is very common surgical procedure. Thank you, Kulbir. So sometime when patient have enlarged prostate, so they will cut the section of it to reduce the pressure on urethra, so patient can wee properly. Yeah. Okay, so because there can be some clots, there can be some bloods in the um, bladder, so that's why we don't want clots to get accumulated in bladder. Okay, so that's why we need continuous bladder irrigation. Alrighty. Um, maintain light pink urine output. Is it good? A. What about A? Just to A? Definitely just to A. Okay, this is our goal because we want to titrate the irrigation rate to keep the urine light pink or clear. It should be either clear or light pink. Okay, yeah. Manually irrigate if catheter obstructed by clot. Have anybody seen manual irrigation or done manual irrigation? B guys. No to B, actually just to B. Okay, especially if you will work in the ER and sometime patients come with obstruction of the bladder. Usually clot gets stuck there. Okay, so you need manual irrigation. Just JJ, definitely we will report, but this is the option. Okay, we are just checking whether it can help or not. Okay, SATA question. Yeah, I'm asking C if somebody C also or somebody done. Okay, so usually provider done, so we can, yeah. And with the manual irrigation, it's always been said that like it is kind of work, like how you are doing work in the gym. You will get all sweat while doing manual irrigation. Titrate flow to keep urine clear. What about C, guys? Is our goal is clear urine? What is our goal? We discussed in A, option A. So C is wrong, guys. C is titrate flow means increase the flow. Okay. So we are not gonna titrate flow to keep urine clear. We don't wanna increase the flow. Our goal is to keep light pink, not clear. Okay. This is our goal in patient with continuous irrigation. Alrighty, light pink. Accept severe bladder spasm without intervention, just blockage. Expect severe bladder spasm without intervention. Yes or no? D, no. Yes, thank you. D is no. We know this is, yeah, okay, this is written like expect severe bladder spasm without intervention. Okay, so we need to actually they should be managed. This is very common complication. They should be managed. Actually, it can be correct because we need to give oxybutynin. So if we are not giving oxybutynin, then we can have. So I'm gonna tick yes to D. Thank you, guys. Okay, because it's without intervention. If we are not giving the oxybutynin, then definitely there will be severe bladder spasm. Okay. Yeah, they're meds to help with spasm. Yeah, definitely. So it should be, yeah, giving. Secure catheter to thigh. What about E? E is yes. Okay, because this is gonna prevent the traction of catheter. This is gonna prevent the traction of catheter and urethra. So there should be no injury. So yeah. And what about F? Record true urine output by subtracting irrigant volume. Is that correct? Yes to F? Yes. Okay, if we are monitoring the urine output, we should subtract the irrigant volume, and that will give us the true urine output. Nice, guys. Keep double tapping and sharing and see which flow to titrate. Continuous irrigation, because we are doing the three-way irrigation, continuous bladder irrigation. So that's why. Okay. The fluid that is going inside the bladder from the bag. That one. Thank you, Raman. Okay, question number 29. The nurse screen a patient for risk factor for bladder scan. Bladder cancer, which apply. Select all that apply. Okay, so we have bladder cancer here, and we need risk factor. So these are two keyword. What about tobacco juice? A. Is smoking risk factor of cancer? Yes. So smoking is a risk factor of cancer regardless where. So tobacco is yes. It is number 1. Chronic exposure to industrial dyes and chemical. What is ADPKD? I will explain, Victoria, after question number 31 or 30. Definitely. Just give me a minute. We already gone twice about that, but I will definitely explain. Yeah. Chronic exposure, B, yes, because there will be amines in that, and like the same way how dye, IV dye, contrast dye cause injury, same way chronic exposure can do the cancer. Recurrent UTIs, yes. Chronic inflammation, keep going up. It can cause the cancer. Chronic irritation, so C is yes. And what about D? Long-term catheter, same way. Like if your recurrent UTI is causing the irritation, same way D, okay, because this is gonna keep causing the irritation over there, and then it's gonna lead to infection, and then it's gonna lead to squamous cell carcinoma. Yeah. So if bladder lining is getting disturbed, getting injured ongoing, then we will have D. And what about male sex? Is it most common in male than female? Yes. Okay. Bladder cancer is more common in male. And what about family history of ADPKD? We just done that. Guys. Polycystic kidney disease. So PKD is polycystic kidney disease. Okay, always remember PKD. And when we have AD, that is autosomal dominant. That means there are multiple cysts in the kidney due to genetic reason. Okay, genetic history. That's why we have autosomal domination of polycystic kidney disease. Yeah. Why bladder cancer? Bladder cancer is common in male. Anyone? Why it is common? Anyone? Hormones? Yes, that can be the one of the reason. That can be one of the reason. You have more. You have more smoking, more tobacco in the male. Okay, male are dominating tobacco use, smoking. They work mostly in the mines, so that's why there is higher statics data according to that also. But what else? What else? Is it the prostate? Nah, it's not the prostate. It's not about prostate. It's just hormones. Okay. Yeah. X. Yeah, they are exposed to chemical. But if in female, the X chromosome is believed to tumor suppressing chromosome. Okay. That's why. That is the another genetic reason, because X chromosome does give the tumor suppressing effect. Okay. So that and the environmental factor. Yes. It could be genetic. It can be genetic. Yeah, definitely. It can be genetic history. That we can't overrule anywhere. Yeah. Okay, let's do question 30. Then we are gonna have 2-minute break. So the nurse suspected child has vesicle rattler reflux. Which findings support this? Select all that apply. So VUR is the time when urine flow backward. Okay, vesicoureteral reflux, VUR. So when it goes back toward the ureter, toward the kidney. So why it happen? Vesis new word. Yeah, vesicoureteral. This is just the condition VUR, reflux VUR. Okay. Recurrent febrile UTI. What about A? If somebody is having UTI ongoing and multiple time, this is the classical presentation of VUR. Okay. Because then bacteria is going upward towards the kidney due to this reflex. A and E, yeah, they both are correct. failure to thrive. So if somebody is having chronic kidney infection, hi Cheeto King, if somebody is having chronic kidney infection, what's gonna happen? Because kidney damage affect the growth also. There will be less erythropoietin, there will be less electrolyte balance. So it does gonna affect. So it will hinder the growth. Daytime enuresis in 10-year-old. ABC. Actually, C is not correct. Okay. Enuresis is not the problem here. The problem here is the febrile UTI. Okay. So if somebody is having febrile UTIs, that is the main concern, not the enuresis. Okay. That can happen due to another reasons also. What about abdominal mass in right upper quadrant? So if somebody is having abdominal mass, is it gonna represent the reflux? No. Okay, because it can be kidney disease, it can be something else, it can be tumor. Okay, maybe PKD, polycystic kidney disease. New onset bedwetting, E. What about E, guys? E, yes. Yes. Okay. This can be sign of UTI also, but this can be sign of UTI relating to VUR. So E is yes. And what about hypertension? We discussed hypertension. Why we can have hypertension? Why we can have hypertension? F, yes, definitely F is yes. Nephropathy, yeah, because now kidney is not working properly, continuously recurrent UTI is happening, so that's why you're gonna have repeated kidney